Today. Thank you so much for joining us. I'm Amrita Nori Sarma, Assistant Professor in the Environmental Health Department here at Boston University School of Public Health. And I want to really thank you all for joining us for our public health conversation on climate and health. What can we do today? This morning, we had a really great discussion with Dr. John Balbus in conversation with Professor Greg Wallenius on the government perspective. And now I'm absolutely delighted to welcome the speakers for the second panel discussion on climate action for equitable, healthy, and climate resilient communities. First, we'll hear from Roseanne Bongiovanni. Ms. Bongiovanni has worked for environmental justice for more than 25 years. Her extensive career began as a young organizer with the Chelsea Green Space Committee. And in 2016, Roseanne transitioned this vital work into the independent environmental justice and public health organization Green Roots, which has played a critical role in the response to the COVID-19 pandemic in both Chelsea as well as East Boston. Under her leadership, Chelsea was named a Culture of Health Prize winner in 2017. Ms. Bongiovanni is also a proud alum of our Boston University School of Public Health. Next, after Ms. Bongiovanni, we will turn to Dr. Sharon Harlan. Dr. Harlan is a professor and the department chair in the Department of Health Sciences at Beauvais College of Health Sciences of Northeastern University. Dr. Harlan's research explores the human health impacts of climate change that are dependent on people's position in social hierarchies, places in built environments of unequal quality, and also policies that improve or impede human adaptive capabilities. She served as an advisor on climate justice and social vulnerability to organizations including the American Sociological Association, the National Center for Atmospheric Research, the US Environmental Protection Agency, and the Social Science Coordinating Committee of the US Global Climate Change Research Program. Next, we will hear from Kathy Boffman-McLeod. Kathy McLeod is the director of the Adrian Arsht Rockefeller Foundation Resilience Center and senior vice president at the Atlantic Council. She leads the center's global strategy to reach 1 billion people worldwide with climate resilience solutions by 2030, with a special focus on society's most vulnerable. Boffman-McLeod is the recipient of the Fuqua School of Business 2021 Leader of Consequence Award and was appointed to the US Federal Emergency Management Agency's National Advisory Council as its first ever climate specialist in 2021. And finally, before our Q&A session, we will wrap up with Dr. Marie O'Neill, a professor of environmental health sciences at the University of Michigan School of Public Health. Professor O'Neill's research interests include health effects of air pollution, temperature extremes, and climate change, including effects on mortality as well as asthma, hospital admissions, and cardiovascular endpoints. She has worked for the US Environmental Protection Agency, the Pan American Health Organization, and in Mexico at the National Institute of Public Health and the National Center for Environmental Health as a Fulbright Scholar. She's been involved in several federally funded research projects that address social disparities of effects of climate on health, including a community-based participatory research project based in Detroit called Climate Hazards, Housing, and Health. Following all of the presentations this morning, we will take questions submitted from our audience. Please be sure to use the Q&A function to submit your questions during the panelists' presentations. And now, Roseanne, I will turn it over to you.
Excellent, thank you so much. Just going to screen share. Yes, thank you so much for having me today. It's wonderful to be in this amazing audience. I'm going to talk with you a little bit about the work that we're doing in Chelsea and East Boston. So I'm Roseanne Bongiovanni. I'm the executive director of Green Roots. Green Roots is a resident-led organization working to achieve environmental justice and improve public health in Chelsea and East Boston. So we're in Massachusetts. Progressive Massachusetts has one of the best reputations, and you would think to yourself, there aren't environmental injustices in Massachusetts, are there? Quite the opposite. The Center for Effective Government, now called Project on Government Oversight, actually gave Massachusetts and only one other state a failing grade, an F grade, for citing toxic facilities next to low-income communities and communities of color. In Chelsea and East Boston, we're living that reality every single day. These are our communities. Chelsea is the smallest the smallest city in the entire state of Massachusetts. At 1.8 square miles, we have close to 50,000 residents living within these very densely populated neighborhoods. About 73% of our community identifies as ethnic minorities, and Pre-pandemic, 24% of our population lived below the poverty lines. You can see from this aerial photo that folks are very densely populated in tight neighborhoods. And that's because just about 40% of our entire city is zoned for residential. So essentially 45 to 50,000 residents are living within 40% of 1.8 square miles. So extremely densely populated neighborhoods. In neighboring East Boston, there are similar demographics with about 5 square miles, but the airport actually occupies about 3 of those miles. So East Boston is roughly 2 square miles, with about 55,000 residents calling Eastie home. 53% identify as Latinx, and 17%, again, pre-pandemic, live below the poverty lines. What does it look like for daily life in Chelsea and East Boston? We are home to 100% of the jet fuel that's used at Logan International Airport. All of these products are stored along our waterfront. 70 to 80% of our region's heating fuel is stored along the banks of the Chelsea Creek. Road salt for over 350 communities in Massachusetts and beyond is stored in these massive piles along the banks of the Chelsea Creek. And we have the second largest privately owned produce distribution center in the entire nation that sees upwards of 37,000 truck trips annually. Much of our city is impervious. About 80% of our entire city, in the city of Chelsea, is impervious, meaning that we have a lot of cement, asphalt, and not very much green space. You can see from these photos here that only about 4 to 5% of our entire city is publicly accessible green space. And despite our valiant efforts, we only have a 2% tree canopy cover in all of Chelsea. You can see in that photo that just some streets are just void of trees. And so what does this mean? This means that communities like Chelsea and East Boston are far more vulnerable to the impacts of long-term chronic disease and infections like from COVID-19. The report that the Attorney General highlighted that was in partnership with the BU School of Public Health showed that environmental justice populations are far more likely to have higher cases of COVID than other communities in Massachusetts and beyond. Just in Chelsea alone, we had 6 to 7 times the state's rate. For much of 2020, we were on the news locally, regionally, nationally, even internationally. Family members in Argentina reached out saying, "I'm seeing Chelsea on the news. Are you all okay?" We were on the news every single day for the world to see just how devastated our community was by COVID-19. For us, we know that there's no mistake that years and decades, really decades of structural racism and discrimination and environmental classism has led to communities like Chelsea, brown, Black immigrant communities, being far more likely to be impacted by COVID-19 than other wealthier communities. We learned, over the course of the 25 plus years that we've been doing environmental justice and public health work, we know that our work is important every single day, but nothing made it feel so much more important and critical than COVID-19. Our work around air quality became just so critically important as we saw that our residents who are so compromised respiratory and cardiovascularly were so impacted by COVID. And so it has us reflecting a bit on our past and where we go from here. So in 2006, there was a proposal to site a dirty diesel peaker power plant on the banks of the Chelsea Creek. The very same proponent who was proposing clean, renewable energy for Nantucket was proposing a dirty diesel power plant on the banks of the Chelsea Creek. That company, Cape Wind, was not telling anybody that they were proposing this dirty diesel power plant on the banks of the Chelsea Creek. And yet when residents got wind of this proposal, we started to do everything in the organizer's playbook. We protested. We showed up at their offices. We wrote letters. We had children writing to politicians. We engaged pro bono attorneys and licensed site professionals. And one of the most important things that we did was we partnered with folks at the BU School of Public Health who helped us to really understand and synthesize these large technical reports about air quality and what they were essentially masking when they were saying, we're not really going to be polluting that much. The folks at the BU School of Public Health helped us to dig through those reports to see actually they're lying about their numbers, and their numbers are much more significant than they're showing. And ultimately, we were successful in stopping that power plant. And so this is what the playground looks like right now, without those horrible stacks looming in the background. Now our children who are at this public school in grades 1 through 4 can play without worrying about hazardous, the addition of new hazardous air pollutants in our community. And just this morning, I actually submitted comments for a project on that site that is now being redeveloped with robust community access to the Chelsea Creek. So 15 years later, we're just so thrilled to see. Sometimes these campaigns take a long time, but in the end, the results are worthwhile, and the efforts are clearly needed. You know, that work was phenomenal, right? We were very excited about having won that major victory with the power plant, but we celebrated for about a whole, 2 New York minutes until we realized, oh my gosh, like Chelsea's air quality is just so bad. How can we stop our efforts around air quality? And you'll see by these statistics here, 63,000 vehicular trips over the Tobin Bridge every single day, 37,000 truck trips stemming to and from New England Produce Center. And that doesn't even include the long haul storage trailers that are there sort of temporarily. Chelsea exceeds the EPA's diesel concentration level by 20%. Chelsea residents face nearly double the risk of air pollutants and 1.5 times the rate of cancer compared to all of Massachusetts. Given those bleak statistics, we couldn't just celebrate and move on. What we had to do was think proactively. How can we address air quality now and in the long term? And so we saw the New England Produce Center as a significant source of air pollution, but also an opportunity to collaborate and to be more forward thinking. And so we reached out to the folks at the New England Produce Center and said, let's work together. Let's invest some federal dollars with local and private dollars to clean some of the dirty diesel that is at the New England Produce Center. So this photo here shows you that these storage reefers, essentially, it's the back of a truck. So imagine an 18-wheeler without the cab. That's what the New England Produce Center is using for additional storage of their produce. And so to cool or warm this box, essentially, they're putting these dirty diesel engines on the back of these trucks so that they could continue to operate their facilities. And so we went in and said, there's a cleaner way to do this. There's a better way to do this. And so let's collaborate. With several $1 million from federal, state, and private resources, we were able to repower or retrofit, that means replace essentially, 132 dirty diesel engines at the New England Produce Center and adjacent businesses outside of the Produce Center. Through that, we eliminated 2,000 tons of annual air pollutants and reduced the use of dirty diesel by 400,000 tons annually. And that ultimately improved public health outcomes and reduced healthcare costs long-term. We didn't know then that those improvements would significantly affect our vulnerability essentially to disease and infection like COVID. But the work continues, and there's so much more work to be done. Just last year, we finally, after years and years of advocacy, won a stationary air quality monitor in Chelsea. So now we've been doing community monitoring with folks like BU School of Public Health for years and years with the side packs and the purple airs and a number of other different monitors, but to have our own stationary monitor in the community so we could accurately tell what's Chelsea's air quality really like? Is the airport impacting us? Are the trucks impacting us? What are some of these sources? When is it higher? When is it lower? When is it safe for us to go out for a run? When is it not? And so we were looking at data from Fenway and Back Bay and making assertions that, oh, maybe this is Chelsea's air quality. Now we know what Chelsea's air quality is like. And so we have this stationary monitor. We have 9 additional mobile monitors, and we're continuing to build off of this each and every day. And what we're doing with these air quality monitors is we're partnering also with the BU School of Public Health to tackle indoor and outdoor air quality. So we have a pilot project that's underway right now. We're very excited about this, where we're actually monitoring indoor air quality, giving folks an indoor purifier and a portable air purifier, having them use this in their home, and then doing additional air quality monitoring and being in constant communication with residents to see what the impact is on the air quality and health in folks' homes. And essentially what we're doing is we're coupling these indoor and outdoor strategies, saying, we can't just look at outdoor, we can't just look at indoor. We need to address air quality holistically throughout all of our communities, so that we're addressing the root cause of some of our community's most significant concerns. We're partnering with the MGH here in Chelsea, especially connecting with folks who are suffering from chronic respiratory disease and making sure that they're priorities for these air purifiers. We're really excited about this pilot, and we'll be expanding to a number of other homes, up to 250 homes later in 2022, once we understand the challenges, the setbacks, the successes of this initial pilot. We're also feeling the heat, right? It's going to be 70 degrees right now. Today I'm sitting on the Chelsea Creek. It's sunny and lovely, and it's March 19th. If it's March 19th and it's almost going to be 70 degrees today, what is it like in July? We're seeing in communities like Chelsea that have so much impervious surfacing, so little green space, such a low tree canopy cover, so much density and so much vehicular pollution, that as the temperatures rise, communities like Chelsea are getting hotter and hotter. Studies show that communities like Chelsea have upwards of 40 degrees hotter neighborhoods, areas than in other communities. One of our young people, also doing community mapping, showed that he took the temperature of a park bench just last year. It registered 130 degrees. 130 degrees in some of our most utilized parks. How could we possibly close our eyes to these long-term impacts of heat and heat island impacts, which only exacerbate public health, cardiovascular disease, respiratory disease, and more, dehydration. And so we've been partnering with the City of Chelsea and the BU School of Public Health on a project called Sea Heat. And what we're essentially doing is we're monitoring outdoor temperatures, but also monitoring the impact on individual folks. What do you feel like when it's hot? Where do you go? How do you experience heat? Where we have personal monitors with folks, and we're also using photo voice to have folks take pictures of what is it like? What does it mean to them? Where are they when it's hot? Where do they go when it's hot? What do they see? What do they feel? And this map shows you some of the emerging heat islands. So we consider all of Chelsea a heat island, but even within Chelsea, there are neighborhoods that are hotter than others. And so one of these heat islands, just underneath the Chelsea map, if you could see my cursor, I'm sorry, just over here, we're actually implementing a coal block strategy. Oh, sorry. Forgot that this is animated and shows you all of the heat sensors. But we're implementing a cool block strategy, and we're again taking this sort of as a pilot. We're taking one block and intensively implementing strategies. We're doing tree planting around the entire block, and if anybody is in the Boston area and interested in joining us, we're starting tree planting on Earth Day, April 22nd, with a group of volunteers. And if you're interested in joining us the next day, we're doing a community cleanup on the 23rd, so you can message me for more information. But essentially, we're putting block-wide tree planting. We're looking at the Boys and Girls Club and partnering with them to install a white roof. And we're reimagining this lot right here, which is right now partially paved and partially just underutilized sort of gravel. And together with the community, we've come up with designs and visions for what this site will look like when we turn it into a lush green space. And so we're monitoring the before and the after to show, hopefully, that our theory is correct, that this block will be much cooler after this intervention is put in place. And we're very excited about this project, again, partnering with BU School of Public Health. And I'll sort of end by saying that there are a lot of lessons to learn through COVID, and so we wanted to share our stories broadly. We created this report, which is essentially a literature review that shows how all of the social determinants of health are interconnected and make Chelsea and communities like Chelsea just so extremely vulnerable. But what this report also does is it puts forth policy recommendations that are critically important for us to take this moment as an inflection moment and move forward to make sure that our health and our environment are prioritized long-term. It also shows just how powerful our collective response to COVID-19 was, and it's really a model for how community organizing is really truly successful for tackling some of the most challenging issues facing communities. So I'll leave you with some parting words of wisdom, maybe, as they're practitioners and academics. We like to share out this sort of advice so that maybe your interactions with community will be even more positive going forward. So we sort of suggest that you uplift community voices. So if you're partnering with low-income communities, communities of color, or any community, in fact, uplift community voices, recognize their lived experience, try not to be extractive. Give just as much as you're taking. We've seen during COVID that there's so much research, or there had been so much research going on in Chelsea, and folks in Chelsea felt like it was extractive. We're giving our blood, we're giving our urine, they're testing our wastewater, they're swabbing, all kinds of different things. What can we do to make sure that as research continues, and it's really powerful, that we're not being extractive from communities? Always partner with folks on the ground, the community-based organizations and other residents who have the experience, and appreciate that lived experience. Many of us don't have the expertise of others, but we have a lot of lived experience, and we know and understand what needs to be done in our neighborhoods. Support those community-led policy and legislative initiatives like the ones that we've put forth in our report, and the ones that the Mass Environmental Justice Roundtable are moving forward. So continuing to support the community-led policy and priorities, and then share out the data. As you're getting the data from community members, make sure to share it back. That's critically important, and often a misstep where academics sometimes come in, partner, and they don't necessarily circle back to folks and share out that data. And that's critically important, and something that I think the BU School of Public Health has done phenomenally. And then, of course, listen and follow the community lead. And this is how you can connect with us if you want more information or want to come out to one of those tree planting or community cleanup events. I really appreciate being here today, and thank you for listening to this presentation.
Wonderful. Thank you so much, Roseanne, for providing that really excellent perspective from on the ground work that's being done in some of our communities around Boston, and also for highlighting the best practices from the engagement between academic institution and community organizations. We really appreciate that perspective.
Thank you.
So as I mentioned earlier, we will go straight into our next presentation. Please keep providing us with your questions for the panelists in the Q&A feature at the bottom of the Zoom. And so now we're going to turn it over to Dr. Harlan.
Thank you. Can you see my screen?
Yes, we can. You're good.
Okay, that's great. So good morning. I'm so pleased to be here and learn from the other speakers and participate in this conversation about what we can do now to prepare for more extreme weather in a way that prioritizes equitable climate adaptation for the marginalized and vulnerable people and communities. I think you're going to see a number of parallels between my presentation and Roseanne's. So I want to offer 3 ideas on how to think about the process of preparing for climate change, and 4 examples of what actions US cities can take now. I don't think any of these are news to those who work in the area of urban climate change, but they bear repeating to emphasize the urgency to do better as future projections become ever closer. So the first idea is that poverty and racism have to be central to the conversation about making and keeping communities safe from clear and present dangers. We have seen over and over again that low-income communities and communities of color are more likely to be in harm's way from more weather disasters and other environmental injustices. And Dr. Balbus's presentation earlier this morning had a nice slide that illustrated this process. So in the language of the Intergovernmental Panel on Climate Change, we have to forge a pro-poor pathway to addressing climate change, whether we're talking at the scale of nations, cities, or neighborhoods. And on this pro-poor pathway, we hope to achieve a fairer distribution of benefits from adaptation and to promote the co-benefits for health and livelihoods. To forge this path, all the players involved in creating change, and there are many players, which I will talk about throughout the presentation, must agree to the basic principles of justice and inclusion for marginalized groups and to act on them. So the first one is the recognition of those structural barriers that limit adaptation capacities. The second is building up a household and community assets so that people have opportunities and freedoms to protect themselves. The third is to represent socially marginal communities and advocates in institutional decision-making about how to address climate change. So encouraging transparency and representation of different voices. And the fourth is fairly distributing the resources to the haves and have-nots. And fair and equitable do not mean equally distributed. The difference principle of distributive justice says that social inequalities should be to the greatest benefit of the least advantaged members of society. So it is fair and justified to engage in needs-based adaptation, where more resources are targeted to the have-nots than to the haves. So climate adaptation strategies will benefit everyone, but needs-based targeted adaptation resources should be the gold standard. And this requires working from the top down, government, industry, developers, and educational institutions, and from the bottom up in partnerships with advocates and those who seek to build up and improve the quality of life, including risk reduction for their communities. And so I was really happy to hear from Dr. Balbus this morning about all the new landscape of action in the federal government. So an important strategy to cement partnerships, the city of Phoenix and Miami-Dade County are the first two local governments to appoint chief heat officers. So the Phoenix Officer of Heat Response and Mitigation, the new office, has been led since November by Professor David Handula, who is a longtime collaborator of mine and of Dr. O'Neill's. After 4.5 months on his new half-time job, he says, a reasonable portion of the day-to-day work is collecting low-hanging fruit or easy missed connections that no one's worked on in the past just because they haven't had the time and focus to do so. So I see this as a really important step at the city level of creating the kind of coordination and overview as Dr. Belbus was talking about in the federal government. So these are my ideas about the process underlying equitable climate adaptation. And next are my 4 examples of people and places that should be priorities. My own research has been on the health hazards of extreme heat, heat waves, and living in the chronically hot climate of Maricopa County, Arizona. So my examples are going to talk about heat abatement and protection, but we can generalize to other climate and weather hazards using the principles, and you can choose floods, winds, air pollution, wildfires, droughts, and the intersectionality of these. The questions remain how to prioritize actions that make the most vulnerable communities more resilient. So the first example is deaths of homeless people. In 2005, a heat wave brought the full force of local government attention to the problem of extreme heat in Maricopa County. A series of reforms were enacted, such as water distribution campaigns and cooling centers. Nevertheless, there is still a shortage of resources and lack of structural changes to meet the needs. So in 2020, there were 323 heat-caused and heat-associated deaths in the county, 323, and 53% were homeless people. And this has been going up over time, despite the efforts. Problem is only going to grow worse with the rent debt incurred during the COVID-19 pandemic and the expiration of eviction moratorium. There are many, many actions needed to house people such as those listed here. And again, Phoenix Heat Officer Handula says the biggest worry for this summer is that our unsheltered population outside the Human Service Campus continues to increase seemingly exponentially by the day. Also in 2020, 40% of those 323 Maricopa County heat deaths occurred indoors, 40% indoors among the housed population. So this being Phoenix, 82% of the homes where those deaths occurred had an air conditioning unit, but 70% of them were not working at the time the bodies were discovered. And this is distressing because the cost of repairs is too high for many low-income people, and low-rent landlords are notorious for not fixing broken air conditioning. In previous years, bodies were found in homes where the electricity had been shut off, but the county health department reports that this did not happen in 2020 because of the emergency electric utility relief package enacted during the pandemic, meaning that people could pay their electric bills. In reality, this woman's death in 2017 stirred public outrage about utilities shutting off power in the summer. And energy assistance programs show that this can be fixed and need to be made permanent. Here it's worth calling example to the good bill in the Oregon State Senate. After the 2021 heat wave in the Pacific Northwest, which was the second worst disaster in the state's history, several new provisions are included in this bill. And one is to provide air conditioning to eligible low-income people, mandating that the new residents be built with adequate cooling abilities, and creating the heat pump deployment program to buy and install heat pumps in low-income homes. So these are maps of variations in urban temperatures and population characteristics, and the Phoenix map is also marked for where heat deaths occurred. So as we've seen this morning, these maps are well known. Virtually every large city in the country has one or more, and we know how to do this. So once you can identify these neighborhoods, which we can, that have the greatest exposure to heat and other hazards, it's not a large leap to target the heat mitigation strategies to those areas. So in a recent paper, my colleagues and I have called this a targeted urban heat mitigation strategy. Some cities do target resources for outdoor heat mitigation by creating parks. This park is an example. This is what it was before, and this is what it is now after having partnered with Arizona State University. And tree planting and maintenance are really quite popular in cities. Many cities do this. The problems are that green and blue spaces in low-income communities are few and far between, as we've heard. So in our most recent publication, my collaborators and I reported on the impacts of cool roofs. These are light reflective materials that reflect the sun's heat back into the atmosphere. And precisely because poor neighborhoods are more densely populated and have more roof area, this is a particularly effective strategy to lower outdoor temperature. And the cool roofs and cool walls can cool indoor temperatures as well. Los Angeles and a few other cities in Southern California are good examples of this, having mandated this in new construction, and then talking about revamping existing buildings. The last thing is empowering communities to advocate for their priorities. So, some of the things we've learned is that to create healthy living environments requires support and action from scientific and professional communities. And so it requires partnering with communities and trying to live out their vision. They want trees and parks, not just for cooling, but for beauty. And they want a clean flowing river. They want to meet basic needs for safety and food and housing and protection of civil rights. So we learned it's not effective to talk to the neighborhood only about organizing around climate change, as we heard in the last presentation. So I think that, these are really good lessons that all of us need to learn about the top-down, bottom-up cooperation. And finally, and in conclusion, I would say that I see the challenges now to addressing climate change are having the motivation and making the political choices to use the knowledge and technological tools we have to reduce structural and social inequalities, and meeting the basic needs of the communities is really what will dictate the human health consequences of extreme heat and other hazards in the foreseeable future. So thank you.
Thank you so much, Dr. Harlan, for that really informative perspective on some of the different projects that you have in various communities around the US, and also, again, for highlighting the needs for academics to focus on the priorities of different communities as we're implementing some of these programs that you've mentioned. That was very informative, so thank you. Great, so moving right along, please remember to provide us with your questions using the Q&A function at the bottom of the Zoom screen. And now I will turn it over to Kathy Bothman-McLeod.
Thank you very much. I'm inspired by what I've seen already, and it underscores the partnership angle. And I'm not at an academic institution, but we are partnered with wonderful academic partners. And I want to start by saying thank you and hello to Dr. Greg Wallenius, who is on the executive committee of the Extreme Heat Resilience Alliance, which is housed and run by my organization, the Adrienne Arsht Rockefeller Foundation Resilience Center. And so, Greg, thanks for all you're doing and for the partnership. And this is going to be like the other side of the coin of the first two presentations. And 8 minutes, we're going to do a rapid fire, no slides. Here we go. It's urgent. It's urgent. It's urgent. The working group 2 IPCC report could not be clearer, and we knew it before, but the statistics, the stories, the recommendations that show us how impactful climate change will be, and to the most vulnerable around the world, here in the US and everywhere. Our mission at the ARSHROC for short, it's a long name, so we shorten it, is to build the individual and community capacity for resilience in the face of climate impacts. So pure adaptation and resilience and urgency. What can we do now? We take the Pareto principle of 80-20. We have enough to do what we need to do, and people do not need to die from heat. And so this session is about what can we do, and we can do a lot. And you saw that from the first two presentations, and I want to give you a different perspective. I sit in Washington, D.C. at a think tank, a 60-year-old global foreign policy organization with many centers. Some are geographic, some are focused on particular themes. This Resilience Center, as I said, is focused on climate adaptation, and we've set a goal of reaching 1 billion people with resilient solutions to climate impacts by 2030. And we specifically work on heat. And as has been said, it's the #1 killer of climate impacts, silent killer, more than any other climate hazard. And it's quiet and it's not dramatic. It doesn't have an agency that owns it. It doesn't have a name. It does not have a season. And the 1,000 plus death toll from the Pacific Northwest heat dome is remarkable. And as I've seen by Chris Eby, called a mass catastrophe event, and that's what this is. And that is the US in a developed context, and it's quite stunning. And so we have made it our mission to bring the actionable awareness and solutions to extreme heat through the build of a global coalition of which Greg Wallenius is a member and a leader in, and through some specific interventions and actions that I want to tell you about. And I want to make sure we can follow up for those who are interested, but the chief heat officer in Miami, Jane Gilbert, is our partner, and it is our organization that launched the chief heat officer concept in Miami. You see that proliferating, which is wonderful. and we have one in Athens and one in Freetown, Sierra Leone. We just announced the metropolitan region of Santiago in Chile, and we have one coming up in 3 weeks in Mexico and next to Oceania. And so we want to have one as a representative on every continent this year. And what comes with that, the symbol of the single place that sits very close to the leadership of a community with a heat health task force and all the tools that you need to understand the size and the nature of the heat risk and impact, starting with the most vulnerable communities. So we have also built the bones of a heat season. How do you build a heat season that looks and feels like hurricane season with the same public awareness and interventions and the public information campaign that goes with it? And we have hurricane preparedness kits. We're making heat preparedness kits in Miami-Dade County with our partners there. And Mayor Daniela Levine Cava will announce official heat season for the county on May 1st this year. Also, we will see first ever named and categorized heat events in Seville, Spain, and in Athens. And so we've built a methodology with we have 2 science panels, one specifically focused on the categorization and the methodology with climatologists and public health specialists and medical doctor, all sorts of scientific perspectives, and from the social sciences as well. And we have a climate psychiatrist in our midst. And we are building a methodology for categorization that sits on top of the National Weather Service system for heat health warning. And we have naming, and we're doing it's a different methodology. It's human behavior, as you all well know. And so we're working with a firm called Marketing for Change and doing focus groups in Spain and Athens. We've done them in the US to understand what is the best naming convention, what will be that trigger that we need for people to act, to protect themselves and their families. We have built out of the Extreme Heat Resilience Alliance 4 working groups that capture the highest priorities from the community, from the incredible work that already exists and has been going on for a very long time. And we want to give it the oomph and, pardon the pun, put some fire under all of it because of the urgency that it faces. And, you know, the show Game of Thrones, winter is coming. I'm getting rid of that and going with summer is coming, but it's not summer. It's really heat season is coming, and it's coming on this side of the planet, and still happening in the southern hemisphere. And so it's happening every day, all the time. And the faster we can do this, more quickly we can do this, the better. And so those categories are building awareness for decision makers linked to vulnerable people. The awareness piece is the gap is so remarkable, which I know you all are well aware. The second is good policy. We've contributed to legislation that's been filed in California that is categorizing heat events, naming a chief heat officer for the state of California. That's Assemblywoman Luz Rivas and her partners and co-sponsors there. And we are excited to see that opportunity for more legislation at the local level. There's some things happening in Miami-Dade County around worker protection. We're understanding the economic impacts to bring policymakers into the issue. We partnered with Vivid Economics to assess the cost of worker productivity loss to the US economy. And in 2020, it was $100 billion, doubles by 2030 to 200, and then to 500 billion to $500 billion by 2050. And of course, those numbers and that loss is not borne equally. It is borne more by the southern states of the US and by people of color and by Hispanic people working outside. And so we are now underway on a 13-city analysis of mortality and economic losses due to worker productivity impacts of heat, and we'll be rolling that out in June. And so a good look across the globe, very different cities: Dhaka, London, Delhi, Freetown, Athens, Monterrey, Mexico, Abu Dhabi, Santiago, think you get the idea. Very different Bangkok. And so back to the categories, policy, talked about that, risk and finance. How much does it cost to have a heat event, get ready for one, recover from one? We don't have the data that we need to fully understand that. And can we bring the understanding along with some financial strategies that don't tap the coffers that are already so stressed from COVID and everything else that's happening right now? And so we're working on understanding how we can deploy finance and risk transfer to help communities deal with this. And then lastly, interventions. What can we do? Lots of things we can do. Green roofs and cool roofs, and the things that you saw in the first two presentations, urban forests, cool roofs, change the design. We know that the urban heat island effect is not helping the way we've built and are continuing to build our urban areas. So lots we can do. And we are beginning to put a concept of a capital stack of investment into things that cool communities. So we can do it at scale, aggregate projects across those 13 cities. And so it's early days, but go from awareness to understanding it, to measuring the risk, to identifying where the most vulnerable are, and then identifying those interventions, and then attracting capital, and all toward the COP27 in Sharm el-Sheikh, Egypt in November. So we're in a hurry, and summer is coming. And I thank you for the time and for inviting me today. And I look forward to the questions. And Greg, thank you again for your partnership. It's inspiring. Thank you.
Thank you so much for that really excellent overview of a lot of the different efforts that are going on, and also for providing us with a sense of, it's urgent, but here are some of the things that we can do to start to try and adapt and mitigate in the face of climate change. So that's really helpful perspective. Wonderful. So I'll just do one final reminder. Please continue submitting your questions for our Q&A session with our panelists coming up very shortly using the Q&A feature at the bottom of the Zoom window. And with that, I'll turn it over to our final panelist, Professor Maria O'Neill.
Thank you so much. And it's a pleasure to be here this morning with this wonderful panel. And I do have some slides to share. I am at the University of Michigan, so I think our Midwest representative, and I feel very fortunate to be going last because I feel like all three of the prior speakers brought up some excellent points that I will echo. But what I am going to talk to you about today is some of the research and action partnerships that we've been engaged in. And specifically, we have a partnership called Climate Hazards, Housing and Health, which originally started as the Heat Waves Housing and Health Partnership. And like some of the others in this group, a lot of my work has been on heat effects on health related to climate change. But our group has been recognizing that there are a range of other climate sensitive health outcomes and climate change related concerns. Extreme precipitation, for example, has led to flooding in Detroit and in many other communities. So we broadened our name to be the Climate Hazards Housing and Health Partnership. And this group was formed in 2016, stemming from connections from the Detroit Community Academic Urban Research Center, which is a collaboration between community representatives in Detroit and academics at the University of Michigan, focused on promoting health equity through community-based participatory research. So our partnership set out with original goals of better understanding how housing can affect people's ability to provide health sustaining and comfortable temperatures to occupants during extreme weather, extremely hot weather. And then also how can interventions or community programs reduce inequities in exposure to extreme temperature and other climate related health risks. And as some of my co-panelists have highlighted, one of the big motivations is environmental justice. We know that health burdens related to heat fall unequally on communities of color, low income, elderly, and children. Dr. Balbus gave many other examples of inequitable impacts. And specifically related to heat, we know that housing quality, air conditioning access, power availability and affordability, and the vegetation in a particular community play important roles on what in terms of whether people's health is impacted. Another motivation for our partnership was a National Science Foundation funded collaboration that Dr. Harlan and other colleagues were part of, enhancing emergency preparedness for critical infrastructure failure during extreme heat events. And this 3-city project was focused on understanding how housing characteristics influence heat to better understand health impacts and adaptation behaviors of vulnerable populations across 3 cities, particularly during a concurrent heat wave and electrical blackout. So this project entailed some complex modeling and collection of data from residents living in all 3 of the study cities. And our group in Michigan realized that the best way to effectively collect the data and also impact change in Detroit, which is one of the study cities, was to engage with community members. There was no other way to get the project going. So we adopted a community-based participatory research approach, and I list here some of the key principles, and others have talked about that. I particularly appreciated Roseanne's comments. But the idea of CBPR is that you have an equal partnership between community and academic participants with power sharing and discussion of what's being done. You assess the community strengths that are brought to the research and the dynamics that might affect the research and application, identify priority public health issues and research questions, and design research together, and then importantly, feeding back and interpreting research findings and disseminating and translating that research into interventions and policy. So that was an approach that we adopted. And I know that's unusual to have this slide so early, but I think it's important to note that this kind of collaborative community-based work requires funding, in part because many of our community partners work for nonprofits. They're largely there to support their constituents. So if we want to ask them to come to a meeting, be with us, we need to compensate them equitably for their time. So we've had small grants and larger grants from several Michigan based funders, and then also some of the National Science Foundation work, the project I mentioned, and one that I'll talk about in the future. And we have a website that talks about some of the folks who've been involved in the partnership, from the community members to multiple students, in particular students representing diverse communities of color who are affected by climate change and heat in particular. So I just want to acknowledge that many of the partnerships that I think all of our speakers have commented on are important for what do we do now, require support and effort, and we very much appreciate the funding that we have received. So building on the prior 3 heat study that we're still working on publishing the data from, the National Science Foundation also has a relatively new funding initiative, Smart and Connected Communities Project, that's really intended to foster the kinds of collaborations that we've been talking about, and also bring technology to bear on issues related to health equity and environmental health. And so our team in Michigan has been launching a project on that, where we're specifically evaluating an energy case manager model, where we're doing an intervention among low and middle income residents of Detroit to see how well they are reducing their energy use. We're offering them opportunities to connect to programs that will reduce energy insecurity, enable people to spend more money on food, medicine, and not to have some of the trade-offs that we've seen as a part of energy injustice. And we're also thinking about, the idea of what are basic electricity needs and how might utility rate structures be rethought to provide equity. And all of this work, as you can see, will involve interaction with our community partners and the residents who participate. And this new project involves, again, the Michigan units, multidisciplinary folks. Tony Reams initially led the project and is now on leave, but he's an engineer. We have engineering and then the Institute for Social Research. So it illustrates that some of what we can do now involves partnering and working with people from multiple disciplines. And then our community partners in Detroit include Friends of Parkside, which is representing residents of a public housing development. And these other two represent two neighborhoods. And then EcoWorks does energy efficiency work in the city of Detroit. Another project that's currently starting is funded by the National Institute for Environmental Health Sciences and is intended to evaluate some of the health benefits or health effects of weatherization of homes. And this, again, is a project that's just being launched in Detroit and other places, but one of the important ways to potentially affect policy is to look at what might be the health benefits, can the cognitive function, the overall productivity of people be enhanced when they live in a comfortable environment. So we're in the process of collecting that kind of data. And even in the park side, we anticipate some weatherization metrics to be instituted and hope to be able to evaluate this kind of natural intervention that will occur soon, because I think that also can be very powerful to say, if we do these things that not only reduce greenhouse gas emissions, they may also enhance people's health and quality of life. So I have a few of the three of the publications that our team has produced, and I think just publishing in the peer review literature is not enough, but to echo Roseanne's comment, we have our community partners engaged in the work, including one effort where we involved our community partners in thinking about our models for the epidemiologic analysis and making changes to that. So it was really a co-analysis of some of the survey data that we gathered with funding from NSF. And with that, I want to just close showing you a picture of some members of our team. Zachary Rowe is our partner at Parkside, but just to show, this was, I believe we had one of our workshops and we got a number of students engaged. And I think that is one of what can we do is work with this new generation and learn from their ideas in terms of working to enhance equity in our climate change mitigation and adaptation policies and actions. So thank you very much for this opportunity.
Thank you so much for that really excellent overview of your research, Dr. O'Neill. That was very informative about some of the work that you've been doing. And I just want to thank again all of our panelists for the wonderful presentations during this session. I think a few different themes have emerged from the presentations, whether it be from the academic partners, from the community organizing, or from the foundation perspective. And one of those things is the consideration of climate change as an environmental justice issue. And another one, I think, is the highlighting of the strength of community partnerships, providing insights and perspectives from the lived experiences of different communities in order to facilitate the development of different interventions in order to try and mitigate and adapt to the effects of climate change. So I'm really thrilled that we have time for a question and answer session with our panelists. I'm going to invite all of the panelists to please turn on your video so that we can move forward with some questions from our audience. But in the meantime, I think I would also like to just start off with more of a broad question that I have across all of the panelists, which is that in the session this morning from Dr. Balbus, we had this really excellent and striking, I think, perspective that he provided on the priorities from the federal government perspective to take actions to preserve and protect health in different communities across the US. And some of the things that Dr. Balbus highlighted, for example, was expanding research on the health impacts of climate change, training of clinicians and other professionals to be aware of the health impacts of climate change, education, and particularly providing resources for mental health resilience among the youth who might be anticipating future climate change, expanding surveillance and things like early warning systems, which we've heard about in today's presentations, funding resilience institutions at the community level, addressing the social determinants of health as a key component of climate, ensuring facility hardening and workforce resilience in the face of climate change, expanding funding for low-income housing and other types of interventions that might be critical for climate change mitigation and adaptation. Or finally, we ended up with devoting most of the resources to the health sector reductions of greenhouse gas emissions. So I just wondered if the panelists could go through and maybe provide a brief perspective from the work that you've been doing and from all of the partnerships, where some of these federal resources might best be placed in the scope and in the spectrum of the work that you've been doing to try and provide the best, maybe we could say, bang for our buck in terms of the provision of federal funding to address some of the immediate and near-term impacts of climate change in these different communities that you've been mentioning in your talks today.
I'm happy to jump in quickly. There's a $2 trillion infrastructure package, and I know that Mitch Landrieu is coordinating all of it for the White House, and the understanding heat health impacts and heat risk informed decisions will enhance the conditions. So it's a huge opportunity money wise for us to invest in heat risk informed infrastructure. There's much more, but just in the time we have, that's my first shot. With there's $2 trillion, let's spend it well. It's going to last a long time.
Yeah, that's very true. Any other perspectives from our panelists?
Sure, I'll offer a perspective. I think, as there's so many things that can be done, but I do think that one of the important ways to move things forward, yes, sort of national policy is important, but I think also funding community-based work, actual interventions, sustained funding for partnerships such as the one that Roseanne talked about and ours, because I think there's nothing like having that long-term on the ground perspective of people who live in the affected communities to really inform what we do and how we do it. So to me, that kind of equal partnership and recognizing the effort, the time, and the resources that it takes to do that kind of partnership well and to make really tangible change, I would say that that's also very important way to invest federal resources.
Great.
But
So
I agree with, sorry.
Go
Go ahead,
Rosie.
Sharon.
All right, I would take the issue of housing security because of work that I'm doing on the unaffordable water bills that the low-income population is experiencing now. And so the utilities, I think, are really partners that need to be brought into this conversation, both electrical and water, as the example I showed about turning off the electricity. And of course, we have water shutoffs in Detroit and in Boston, and we have, these kinds of issues. And the federal COVID relief was actually a good example of how these can be stopped by providing federal funds and relief. And that should be continued, because there's a danger as these moratoria expire and water and now accumulated debt has mounted. We need to do something to do that, because no one can be safe if they don't have water and if they don't have electricity and if they get evicted.
I would just say amen to all of that, everything that Marie said and Sharon. I feel like the one thing that I would say is that, making the process of getting federal dollars is incredibly important. And so I think there's an effort through Justice 40 to make sure that low-income communities and communities of color, environmental justice communities are accessing those dollars. But it's still, a work in process that we're seeing that, it's not easy to access federal dollars. And then once you access the federal dollars, it's almost like you have to jump through a million hoops after the fact. And so I think the process of getting the dollars is really important. And just to build off of what Sharon said, we were participating in our community's ARPA process the other night, and we have $15 million to spend in Chelsea. And we have this is our form, right? We have 7 priority areas that doesn't even include everything that our community is dealing with. And each of the priority areas, there are 10 areas, 10 action items under each of these topics. Like $15 million doesn't go that far. And so I'm excited about the federal dollars, but it feels like the issues are so significant that there's just never enough. One of our climate projects is looking at $68 million to implement it.
Wow.
Get all of that money, right? So these are massive projects that need significant investments.
Great. So I'm going to move over to questions that we have coming in from our audience. Thank you again so much for all of these perspectives. This question came in specific to Roseanne, but I'd like to maybe make it a little bit broader to talk to all of our panelists this morning. The question is, what are the challenges or problems, or maybe even the complaints that the communities raise about the work of academic partners? And how do we start to address some of those issues? More specifically, do community members sometimes have trouble recognizing the value of these academic partnerships? And are there things that we can do to improve this cross-collaboration effort?
Do I want to jump into that question?
Yeah, go ahead, please.
Okay, sorry. I know that you said it came in for me, but for other folks as well. I think trust and communication are the foremost items I think that are critically important. I said in my presentation, letting community members lead, and what we have experienced in Chelsea. For folks who aren't familiar with Chelsea, we have a long history of challenges, from being taken under state receivership because our mayors were corrupt and bankrupt our city, to our public school system being taken over by Boston University. When I was a freshman in high school, those doors were shut to the high school and all of public schools because we were bankrupt. And luckily a few days later, those doors were open. And then COVID, right? There have just been so many ups and downs in our community. And I feel like there have been so many instances where academic institutions have come in to say, let's do some research. Let's try something new with these kids at the high school. Let's try something new with these kids in the elementary school. Let's figure out what's going on with folks, doubling and tripling up in apartments and homes. And so I feel like the research is critically important, because that's the only way we're going to continue to get better and learn from our mistakes of the past. But at the same point in time, developing really strong relationships with community-based organizations and leaders on the ground to value their input and I would just continue to say, let the folks on the ground lead and recognize, like, if they say, I think that we should do it this way, or let's think about that. Let's compensate, as I think it was Marie said, let's compensate our community members for their time and their lived experience and their valuable input. Let's make sure that they feel appreciated. If young people are involved in community-based research, let's make sure that they're listed as co-PIs so that they can put that on their college applications, right? Let's bring them into to universities and give them a shot. And I just feel like the most that we can do to build up communities and to value those relationships and to build trust is critically important. And I think that then continues the community and academic partnerships moving forward. So without that trust, all of research is going to be shut down because people will have a negative perception. And so if we can continue to build positively, I think that is so much better for all of our movements.
Wonderful. I'll open that question up to other panelists for additional perspectives as well.
Yeah, I would just say there are challenges, and among the challenges are, I think some of the challenges are addressed in part by considering these are equal partners. So if you're writing a grant, not only do you write in a compensation for meetings, but think about writing a subcontract for your nonprofit partner and encouraging them to negotiate for a decent indirect cost rate, maybe not as high as our academic institutions have, but those are some of the kinds of things that I think are really important, that it should be baseline assumption that we're all being compensated for the work. And I think the second component, is addressing some of the challenges are being open to hearing from your partners about maybe you should change the approach to the research, because we have done that sometimes. Maybe we should ask the question, how can we more quickly get these results into the hands of people who can make a difference? So even most recently with our Smart and Connected Communities project, we were talking about, can we make a phone app or something with some of the data? Even if our team isn't, that's not our thing, maybe there's a way to think about, spinning off so the results are actually useful for people on the ground. But I think it goes back to, the trust and the openness and truly, realizing that your research can be improved by listening and changing in response to people whose lived experiences really, aren't yours. Thank you.
Great. So maybe Sharon, did you want to add another thing?
Next
Okay.
question.
Yeah, I was just going to say, maybe in the interest of time, we'll move on to the next question. So the next one is kind of maybe generally for the panelists, but I think that this is a really excellent question, which is, do you have any books or podcasts or documentaries that are specifically on the topics of environmental justice and climate justice that you can recommend for some of the folks who are listening in today? I think this speaks to the question of how do we translate some of the research and some of the findings that we have here into more of a wider audience. And so what are some of the resources that you turn to and recommend to folks that are outside of academia, maybe you're outside of the research side of things, to provide the perspectives that people might need for the importance of this work?
I've got one right off the top of my head, and I want to confirm I've got the author correct. It is about it's called Heat Wave, and it's about the Chicago heat wave. And the author is Eric Klinenberg. Highly recommend it. It's a blend of storytelling, but it's environmental justice at its very best explanation through a heat wave that is in the vein of the opening scene of Ministry for the Future by Kim Stanley Robinson. Mm-hmm. But it's real.
Yeah.
Yeah.
That's a really excellent example. That's one of the books that I always turn to as the first pass. Yeah.
Yeah.
I would add Farming While Black It's
Oh, yeah.
a soul fire farm in New York, and it's really about food justice and food sovereignty. And
That's
I feel
great.
like that is an amazing book, not specifically about climate, but definitely
Mhm.
under the umbrella of climate and environmental health.
Great. So there are a couple of questions that are specific to some of the work that was mentioned in the talks today. So maybe I'll go through a few of those if that's okay. So one of the questions that we did receive is for Roseanne, which was asking when you were talking about the project to replace engines at the produce center, can you let our audience know what the dirty diesel was replaced with?
Yeah, absolutely. So the engines at the New England Produce Center, the ones that we replaced, the dirty diesels, we took off the back of those reefers and destroyed them and replaced them with electric engines. They were Vector 5100s. And so we had to essentially dig in the produce center and construct an electric backbone throughout all of the produce center so that these engines could plug in. And that was, about 10 years ago or so. We were conflicted at the time because we knew that the electric engines still, they're still connected to the grid, and where is the grid getting its energy? And so in this case, it was from a power plant that's in Everett. And so we were deeply concerned about that. And so we had to balance out what are the immediate impacts, long-term, what are the larger impacts, and just if we continue to use diesel versus the electric engines. And we ultimately decided to move forward with the electric engines. But I would say that we don't think that the electric grid is always the cleanest, and that it is as far as long as it's continuing to be connected to fossil fuels, that's definitely problematic. And so it's not it's not an all-out solution until we're moving fully towards renewable and fossil free. And then some of the other engines that we also retrofitted as part of that project were heavy construction equipment that you can't actually use, or at the time there were no electric counterparts. And so we retrofitted those to have additional particulate filters on those engines.
Wonderful, thank you. I think this next question is for Kathy. This question came in thinking about the work that you've been describing about naming heat waves. So the audience member is interested to understand how long that process is taking specifically for Sevilla and Athens. And they mentioned that there might be some interest in doing something similar for the Metro Boston area.
Super. Let me send you my email. The May 1 kicks off the pilot season in Sevilla and in Athens. Athens is categorizing and Sevilla is naming and categorizing. So we'll have data and some performance at the end of this heat season. So we'd love to talk and share the methodology, and absolutely.
Great,
Thank you,
wonderful. And so another question that came in is directed to Marie. So this question from our audience asks what exposures your weatherization study considers. For example, do you look at temperature as well as air pollution, maybe some other meteorological characteristics? And maybe I would expand that to say, what are some of the exposures that you might be interested in incorporating into that work in the future?
Yes, thank you for expanding on that. And I just want to acknowledge that that work is led by Karina Grunland. She's the PI of the project. And these are actually questions that we were just talking about, that right now the study isn't funded to evaluate air pollution, but we certainly know that indoor air pollution can, be helped, or in some cases, worsened by weatherization, where you better insulate a house, and maybe, in some places opening a window isn't something that people do because they don't feel safe doing that, or the quality of the air outside isn't great. So I think what the focus right now has been on temperature and humidity, but I agree that, I think that is something that we will think about. I think the other thing that we know is that there are a whole range of exposures that might be relevant to asthma, for example, that have to do with indoor air quality. So that's kind of part and parcel of what we think about when we think about enhancing energy efficiency. We don't also want to damage people's health, or have unforeseen consequences.
Great, thank you. So this next question, I'm going to direct it to you, Sharon. The audience member mentions that higher education is very well represented on our panel, and also talks about, the issues of housing and the importance of built environment characteristics for being protective for health during especially these summertime periods. And they bring up particularly that colleges are hosting young students during summertime periods. And often these students might be staying in housing that's not designed to host people during those same summertime periods. And so they're wondering what efforts are going on at different academic institutions, and maybe a couple of different people on the panel can provide the perspectives on this question in order to try and reduce the health impacts of heat in these structures that aren't necessarily designed to host students and young people during these summertime periods.
Yeah, thank you for that question. It's interesting because I just copied it out of the chat and put it into my notes. I've been involved for the past year or so on a climate justice task force at Northeastern University. And it's pretty clear that universities all over the country have these climate justice task force, but they are focused a lot on fossil fuel divestment. They're focused a lot on our relationships with surrounding communities and the way we've perpetrated injustices there, and really focused on, issues about campus buildings and energy efficiency and so forth. I have not heard this question about, student accommodations. And so this is one that I will bring back to that task force and say, how do we think really about rectifying our housing for students and for other people working on campus? I think there hasn't been enough attention to actually the facilities and the grounds of campuses and the way that we design ourselves and the way we're building. I know that we're building a lot and trying to be responsive to new standards of building, but I think there's a lot more that's to be said for looking to our own house and how we're treating our employees and our students.
Wonderful, thank you so much. So there have been a couple of questions that have come through the chat, and they've been particular for Kathy, but I just also want to maybe have you provide a perspective and then expand it out to some of the other folks on the panel. So the questions that came in are really taking an international perspective. A lot of the work that we've been talking about has been very local scale, but as we know, climate change is an issue on all scales from local to global. And so some of the questions around, the international perspective have been coming in looking at what are the effects that we've seen of the interventions that have been implemented in different places? What are the evidence bases that we're using to apply some of these interventions? And maybe what are some plans in the future for additional research projects that may be in more of a global health perspective?
I know some
Yeah,
of them
please
were
go ahead.
Sure.
Yeah.
So there are also some questions about what's happening in India. So let me start by saying we work in Tamil Nadu and in Chennai, and then we're beginning to form some partnerships in Ahmedabad. Pune is on the list, but not yet. And just in terms of the research, you could probably get a sense by the type of activities that we're launching in the initiatives. We're using a combination of partnerships on the ground, strategic communications, policy levers, creating enabling conditions. And so the research component and the evidence base is essential to get us started and then to assess. And so lots of partners around this work will be conducting the research and the M&E that's necessary to be able to make improvements. And so organizations like NIHIS and the National Integrated Heat Health it's a lot of letters, Heat Health Integrated Information System, and then GIN, the Global Heat Health Information System, both surround this work in addition to our science panels and then the scientific organizations at the government level inside each country. And so the National Observatory of Athens, working with local elements of NOAA and universities in the US here. And so I hope that gives you a flavor. There's so much more to this, but it's a mosaic of efforts from the research to the evaluation, to the improvement, to the implementation. And then there's the whole finance piece. And so it's an evolving, I think of it as pointillism. We're all in there with doing our pieces, but it's organized like a mosaic and it's beautiful, becoming more and more beautiful. Yeah.
Thank you. I invite other panelists to weigh in on projects that you might have interest in globally, or interventions that you've seen that have been particularly effective, or the ways that you evaluate them.
Nature-based solutions. They're highly effective, but they have to be done well. And maladaptation is a very real threat. We've got to be very careful about the species and the care for it, and planning for how much it actually costs to keep it alive, and have investment in the community. We're working with Mayor Yvonne Aki Sawyer of Freetown. She has an initiative called Freetown, the Tree Town, and community members adopt a tree, and through the app are paid to care for the tree, using their app to take photos and post on its success. And so there's an investment in the life of that tree and the health of that tree from an individual in the community. And so that's one example of mitigating the risk of planting things that don't live or are not right in the right place.
Great.
This is a whole 2-hour session all on its own. So maybe we can do it.
So then maybe a couple of final questions. So the first one that I have for you is, we spent a lot of time discussing the need for diverse partnerships and collaboration between different stakeholders. So we would love to get your perspectives, maybe, in a couple of ideas or thoughts. Who's missing from the table that really should have a seat at the table? Is there anyone that we can identify who needs to come and join these discussions in order to continue to improve the health of the benefits that we're accruing from this research agenda, from these policy agendas focused on climate and environmental justice?
I could go quickly and say, I think technology is a huge lever for this, and they're at the table, but not fully. And I think the private sector, we're going to have to leverage private sector investment to get to the levels of protection that we need, and Indigenous voices, indeed. Yeah, the solutions are there and have been for a very long time, and we've gotten away from how we live at one with our environment, and yeah, they're right in front of our face. And we're putting a process map and all sorts of spreadsheets and stuff, and yeah.
I would add the healthcare workforce, clinicians, doctors, nurses, people who work in the professions and actually see patients need more education about the environment and environmental illnesses and what they might be seeing in their patients that could be connected to environmental problems and climate change.
Right. So I hate to cut off the conversation. It's been so excellent. And I want to thank you all again for your perspective. So one final question that I have that maybe wraps up some of the questions that we've received from the audience. If people would like to get involved with some of the work that you're doing, can you maybe provide a little bit of a way that they can reach out to you or get in touch with you and see some of the work that's going on, some of the opportunities that you have to participate in some of these excellent projects?
For us, follow us on Facebook. Green Roots, we're at Green Roots Chelsea, and or email us, and we'll connect you. We have a lot of activities if you want to get involved.
Thank you.
We are www.1billionresilient.org, and everything you need's in there. How to get to each of us and find what you're looking for, and you can find me there too.
Great, thank you. All right. Oh, sorry. Go ahead.
Email is good.
Okay, wonderful.
Yep, same.
All right, so that was our final question. Before we end the event, I'd like to once again take the opportunity to thank our speakers for their truly thoughtful insights on this topic of climate and health and what we can be doing today. I'd also like to thank our audience for all of their questions and for all of your participation in the event today. Our second keynote speaker, Dr. Francesca Dominici, will be joining us at 12 noon Eastern time. So please use the same link to join for that event. And with that, I want to say thank you and look forward to ongoing conversations.